So you finally have decided that now's the time to start reversing your diabetes. Well, before you do that, there are 4 items or criteria you need to make sure you check off before you start the process of moving towards reversing your diabetes. So let's go into those 4 different items. Item number 1, it's what I like to refer to as motivation. What is motivating you to reverse your type 2 diabetes? Is it because you just don't want to be a diabetic anymore? You want to get off medication? Or is it more of a situation of you don't want it to progress to the point where you have to dialysis or lose a leg or develop dementia, etc.? Because your motivation is what's going to drive you. And if your motivation is only because you no longer want to become a diabetic, I can tell you, you're likely going to fail. Because when the going gets tough, you're going to say, oh, this is too hard and I can't continue. But if your motivation is to do whatever it takes to really fight the fight and get to a point where you're no longer diabetic, and trust me, that is possible, your motivation has to be there first. I always say the first step in reversing diabetes is 6 inches between your ears, because when you are motivated and driven and it's up here and you're ready to do whatever it takes, you're the rhinoceros that'll run through any kind of door or wall, nothing can stop you. So make sure, number 1, that your motivation is there. And what is your motivation? Write it down. Be specific of why you're really wanting to reverse your diabetes. Once you have your motivation down, then you can go to step number 2. You have to find the right clinician to help you. You can't just go to your traditional doctor or even an endocrinologist and think they're going to help you to reverse your diabetes. Remember, their goal is to not help you reverse your diabetes. Their goal is to help you manage your diabetes by using pharmaceutical drugs and telling you to lose some weight or change your diet, etc. That is not going to be the situation you need. You cannot reverse diabetes by thinking you're just going to go to a traditional doctor. You need to find a doctor who specializes in reversing type 2 diabetes. These are specifically functional medicine doctors. That's what specifically I do. We are trained in a way to evaluate individuals to identify what needs to be done to get them to the point where their body has no longer seen or identifying type 2 diabetes. So you need to find the right individual. That could be someone like myself, or seek out, look at other YouTube videos or other social media, or just research areas in your own hometown. But again, you need to find the right doctor and make sure you interview them, that they are actually going to help you reverse your diabetes, not just give you another pharmaceutical drug or to help you manage your diet a little more. It has to be specific. And steps number 3 and number 4 are you going to know exactly if this individual is the right person for you to really help you down the course to reverse your diabetes. Listen, I've been reversing diabetes and helping patients reverse diabetes for over 20 years. If you want to learn more about what we do and what you need to do to get to the point where you can start reversing diabetes, make sure you download my guide here below, because this is packed full of information that's going to help you choose the right steps and what needs to be done to reverse your diabetes. So let's go to step number 3. Because step number 3, you have to be specifically evaluated. You have to be comprehensively evaluated. Now, this is very important because the type of testing that you're being evaluated currently by your traditional doctors are not even scratching the surface when you use the word comprehensive. Most of the tests that I look at that are coming from the traditional medical world are evaluating you to see what medication you need. Is the current medication working, or do you need an alternative medication? That is typically the reason why you're being evaluated. Not what is causing your diabetes, how is this occurring, what needs to be done. It specifically is the current treatment you're doing working, or do you need an alternative treatment in regards to using pharmaceutical drugs? So by finding the right clinician, what we talked about in step number 2, is going to help you to identify what tests you need to run. These are outside the normal specific model of traditional medicine. You need to look at this more aggressively to see what is going on. You can leave no stone unturned, because unless you get comprehensively evaluated, you can't identify what specifically is going on. As a functional medicine practitioner, when we're evaluating someone, we're evaluating for cause. See, you have to understand what is causing your diabetes. And I'm not talking about it's because of your lifestyle or because you have high sugars. Those are symptoms of the deeper problem that are going on. Most of the individuals that we evaluate have 10, 12, 15, 17 plus different problems. So imagine if you had 10 problems, as an example, and you started working on 3 of them. Maybe one of them is you do need to change your lifestyle and you need to eat better, or you do need to lose some weight, or you need to start exercising. Great, you've now addressed 3 of the problems. What about the other 7? See, you have to make sure you're working with the right clinician, the right individual who can take you down the right steps, which means on your step number 4, it requires a customized plan of action. There is no one-size-fits-all approach to diabetes. There is no one-size-fits-all nutrition plan. It's not about how much weight you need to lose or how much exercise. Are those things beneficial? Yes, but isn't it beneficial to everybody? What human being should not be eating well, should not be exercising regularly, should not keep a good weight? We all should. Has no specificity to diabetes. Now, by doing those things, will it help you lower your sugars? Yes, absolutely. But if you've watched any of my videos, which I engage you to start doing that if you will, is that we know diabetes is not a blood sugar problem. It is a cellular disease. So we have to identify what problems are contributing to your cellular disease so that you can create a customized solution. The customized solution is the key component here. If you're not customizing your approach, then you're just doing the one-size-fits-all and crossing your fingers, hoping it's going to work and praying on the back end. We don't want to hope and pray. We don't want to assume things are going to work. We want to know they're going to work. By identifying the specific problems, we can create a customized solution. So when you take these 4 steps in process, number 1, you got to be motivated. What is motivating you to do whatever it takes? Number 2, finding the right clinician, specifically a functional medicine clinician. Number 3, you have to be comprehensively evaluated. Number 4, you need a customized solution. And if you want to learn more about how we do this specifically in our practice, make sure you watch this video here where I'll go into more detail of the specifics of how we help people reverse diabetes and how I've helped thousands of individuals reverse their diabetes and become non-diabetic.